The objectives for this video is to state indications for placement and use of an EVD, gather necessary equipment, assemble the drainage system and primes the system per manufacturer's recommendation, levels the drain, and zeros the transducer, demonstrate sterile setup of an EVD, and verbalize documentation requirements.
Hi, my name is Caleb Cooper. I'm a nurse practitioner with the neurosurgery team at Eden Medical Center. EVDs are placed as a therapeutic strategy for central nervous system diseases that can cause increased intracranial pressure, such as traumatic brain injury, subarachnoid hemorrhage, acute hydrocephalus, posterior fossa tumors, and even meningitis. When a patient is assessed in the emergency department, the neurosurgery team determines the need for the EVD based on CT imaging, diagnosis, and the Glasgow Coma score. EVDs are typically placed in the frontal horn of the lateral ventricle, ending close to the foramen of Monro. The right side is often preferred as it is the non-dominant hemisphere. We want our ICU team to feel comfortable with this process.
Common indications include raised intracranial pressure, ICP, associated with traumatic brain injury, subarachnoid hemorrhage, acute hydrocephalus, posterior fossa tumors, meningitis.
Hello, my name is Sharon Connors-Feller. I am a nurse at Eden Medical Center in the Neurotrauma ICU, and I have 36 years of experience in ICU. Today we're going to talk about the setup and maintenance of an EVD. Maintenance and troubleshooting an EVD is a nursing responsibility. CSF is clear, colorless, and odorless. It's a derivative of plasma and acts as a cushion in the brain, providing nourishment as well as taking away debris. CSF is produced by the choroid plexi of the lateral ventricles. From here, it flows through the foramen of Monro into the third ventricle, through the aqueduct of Sylvius into the fourth ventricle, through the foramen of Luschka and Magende into the subarachnoid space of the brain and the spinal column. It acts as a cushion. It helps to protect the brain. And there's approximately 10 to 15 mLs of CSF produced every hour, or 500 to 600 a day. CSF is reabsorbed through the arachnoid villi into the venous system. Now let's talk about the Monro-Kelly hypothesis. And that states that our skull is rigid and the volume within our skull is fixed. It's composed of brain, 87%, blood, which is 4%, and CSF, which is 9%. An increase in one component must also have a decrease in another component to maintain normal ICP. Okay, so now let's talk about the setup, the maintenance, and the zeroing of an EVD. Okay, so now we're going to go over the equipment that you need to set up an EVD and how to set up the room. So remember, in the ICU, we have 2 neuro carts on each wing on the A and B in the clean equipment room. So please bring that to your room. Remember, you have to plug in the neuro cart or it's going to die. From the neuro cart, you're going to take out your Buretrol. This is what you're going to mount on an IV pole. Next, you're going to take out your cranial access kit. Your cranial access kit is good for EVD insertion and also for Camino bolt insertion. Take out a surgical sterile gown for your neurosurgeon. You're also going to need a sterile dressing, making sure that you have a bio patch on. You're going to need 3/0 nylon, a single transducer, a bactericidal impregnated EVD catheter, a mask, a bouffant cap. Masks and bouffant caps have to be worn by each member of the team in the room during insertion. Clippers with a blue clipper head, chlorhexidine without a tint, Sterile saline, autoclaved. This is used only for the brain, and this is what we use to prime the system. And a chucks to put under the patient's head.
Push back any equipment for easy access to back of the bed. Move the patient up, so patient's head is at the top of the bed. Remove headboard off the bed. Put chucks under the patient's head. Adjust bed height appropriate to the neurosurgeon. Place the open-top garbage bin at a convenient place with reach if standing at HOB. Clear off the bedside table so that the MD can use it during the procedure. Grab an IV pole, pressure cable, and the neurocart from the rolling utility room and remove the above supplies. Make sure you fill out the inventory list so that the resource nurse can replace what is used during the procedure. Consider sedation or analgesia or both. Consider restraints for an agitated patient. Check INR. Document timeout in the Universal Protocol flowsheet in EPIC. Please refer to the Universal Protocol policy for more information.
Okay, so now we're going to set up the EVD. First thing you're going to need is a bedside table. And we're going to wipe this down with some wipes, bactericidal wipes. And we're going to create a sterile field. I like to use my gloves, the backing on my gloves, to do that. So for the setup, you're going to need a single transducer, sterile autoclave saline, and 2 pairs of sterile gloves. You also have to wear a bouffant cap and a mask, and anybody in the room also has to do that. This is your Buretrol. So everything you need for the IV pole is in this Buretrol, and we're going to add the 3-way stopcock and transducer. It's very important not to throw out my leveler. It sits on top of the Buretrol. We often get busy and throw this out, and it's vitally important that we don't. So while Roselle is opening the Buretrol, I'm going to wash my hands and set up. So now I'm going to take the Buretrol out of its box. As you can see, it comes in one piece, and the only thing we need to actually attach is a single transducer. The Buretrol has a black and white markings. The black markings are in centimeters of water, and then the white markings are in millimeters of mercury. Here at Eden, we monitor in centimeters of water. Here, the catheter will be attached to the end of this tubing. It's really important to keep the tubing within the bag until it's time to hand it to the neurosurgeon. And then this is your Buretrol, and this can be moved up and down by using these little squishy things up here. So I'm going to move it down to 10 centimeters of water. Up here we have some rope. This is going to attach to the top of the IV pole. It acts as just a safety mechanism so the Buretrol doesn't fall off the pole. And on the back, we have this squishy thing that ties onto the pole. So when you depress the lever, it opens the teeth here and it attaches to the pole in that way. Okay, so now we're going to attach it to the pole. I depress the lever and it just clips onto the pole. I'm now going to open this rope and attach it up here. So now it's nice and tight. So once your EVD is mounted on the pole with your safety ropes up here, clipped on nice and securely on, now we're going to open up our leveler. Remember not to throw it out. And this is what it looks like. And we're going to level this. Every time we move the patient in the bed, we're going to level them with the tragus. And as you can see, there's a bubble in the middle. And that bubble has to be in the center, okay? So this, if I turn this around, you'll see there's a hole for it on the side, and it's going to clip in there. And it clips in, you can hear it. So that's it. Now we're going to set up for putting your transducer on. So for this, open up your sterile saline. You're going to open up your single transducer. You're going to open up your chlorhexidine wand with no tint and 2 pairs of sterile gloves. Okay, now I'm going to wash my hands. Come back. I'm putting on my sterile gloves. So I'm going to use the wrapping of my sterile gloves as a sterile field, and I'm going to get my sterile saline. I'm going to make sure that there are no bubbles in it, and I'm going to attach it to the back of my transducer. Now I'm going to come over to my EVD. I'm going to take this off using this glove. Now this hand is dirty, and in my clean hand I'm going to clean it for 15 seconds. And let it dry. Discard that set of gloves, and now I'm going to attach my transducer. Make sure you screw this on very tightly. It has to be very secure. So now I have my syringe here. I have a sterile hand, and this is going to be my dirty hand over here. I'm going to flush into the buretrol. Make sure there's no air in the line, and then I'm going to flick this upwards, and now I'm going to flush into this bag. And now you can see fluid in the bag. So now my system is primed. Over here, you want to make sure that you empty out any of the saline that's here into the bag. So drain that out. So now there's no fluid in the buretrol, and make sure it's in the up position. Then back here to our EVD, you just want to make sure also that you flush your side port. So get all the air out of there. Our last step is we have to change these caps that have a hole in them with solid caps. So I'm going to take off my dirty gloves and put some fresh gloves on. And from this bag that comes with my single transducer, I'm going to attach my solid caps. And now you can attach your system to the Philips monitor. Okay, so now we're going to level our EVD to the patient. We do this by using our leveler, and we correspond it to the tragus. The tragus is that little bumpy thing in your ear, and we want the bubble to be in between the two black lines. The tragus corresponds with the foramen of Monro in the brain. Once your drain is level, we're now going to open it to atmospheric air and press 0 up on my Philips monitor. It's going to ding once, it's going to ding twice, and it should come to 0. Once it comes to 0, you can put your cap back on and you should get a nice waveform. If you don't see a waveform, put it on optimum scale. Once you hit optimum scale, you should see your nice waveform. If you don't, check to make sure your EVD isn't clamped anywhere in the system, and make sure it's draining. So you can drop the level of your drain, and the system is patent if you see fluid coming out, and then put it back up to 10. So regarding setup, if the nurse setting up your system accidentally throws this out, we actually have rulers on both sides of the ICU that look like this with a leveler. And then you can just level your transducer to your tragus, and it does the same thing. Okay, so now we're coming towards the end of our little in-service. Moving on to the most important part, documentation. So remember, your drainage system is a gravity drainage system. So every hour, at the top of the hour, we flick this upwards to have my drain talk to my brain to get an accurate ICP number. So in the flicked up position, where now I can have no drainage to my buretrol, I'm going to get an accurate number. This is the number that we're going to document at the top of the hour in vital signs complex. The Philips monitor will capture every number when it's open to drain, but that's an inaccurate number. So it is vital that you flick it up, and then you go into your vital signs complex and then capture your number for the hour. Sometimes you have to change it, and sometimes it's the same number. I'm going to drain whatever's in the buretrol. So if there's 5 cc's, I'm going to open it here, drain it into the bag, and close it again. Once I have those 2 points, I'm going to open it to drain again. So documentation, the number I got when I flicked it up, that's going to be in vital signs complex. And then in I's and O's, I'm going to put how many cc's were in there, as well as the color and how it looks. Once I have that done, I'm going to open it to drain again. When it's open to drain, I should have no waveform up on my Philips monitor. So that's a good little takeaway. If you're standing in the doorway and you see a waveform, you know that my system isn't draining, that this is flicked in the upright position. So make sure you open it to drain again. So put in the amount every hour. It's required documentation. We really need to do this on the hour, every hour. When you're going off duty at 7 p.m., the off-going nurse is responsible for capturing those numbers.
Thank you for watching our video.
We really hope you found it helpful.